Go ahead.
Good morning, everyone. Many of you know me, but as we continue to grow and expand and do what is required to be a high-performing cancer center, I'm sure there are a few of you I have not met, and some of you that don't know who I am. So I want to introduce myself first. I'm Lamont Yoder. I'm the Senior Associate Administrator for Oncology for Banner Health, so I have responsibility for the Cancer Center and for the Banner MD Anderson programs as we partner with Houston and expand to other sites. So currently Desert and Thunderbird, the Banner Children's Program, forming and launching this year. Our colleagues at Banner Boswell that will join us in July, and then recently our addition of medical oncologists at Baywood and Desert that will launch in the next couple months. So for the last Cancer Center staff meeting that we had, I just really enjoyed it. It was actually the first one. I really enjoyed listening and seeing to all the different departments working together, and so I've been really excited about being there this time to share a few things about our expansion with Banner Health and MD Anderson. So as you all have experienced some changes, I'm sure recently, I've experienced some changes every day and every week that unfortunately for today's meeting required me on short notice having to meet at corporate, Dr. Collister and I, with our Banner Health presidents and talk about all the things that are going on with the University of Arizona Health Network, our assessment of the Northern Colorado Network, and what might we do next with Banner Health and MD Anderson partnering together. So unfortunately, I had to be at that meeting and I'm missing each of you, but I am so excited to share that things have never been stronger between Banner Health and MD Anderson. And we have some really exciting things coming up that I'm hoping as those decisions get made, as soon as I know more in the next couple months, I'll be able to come and share even more exciting news at the next all-staff meeting. So thanks for understanding that I could not be there right now as you're meeting and listening to this. I am at corporate meeting with the regional presidents and talking about the future of our programs in Banner Health. So we really have continued to experience unprecedented growth and excitement about the clinical program that we're bringing, and I'm really going to be excited to hear the final decisions coming in the next few months that I'll be able to bring to the next staff meeting together. So with all of this change in mind and that theme, I wanted to just take a minute to encourage each of you to continue to focus on what's really important, and that's what's in your control, the patient in their cancer journey today. There's a lot going on and a lot of change and rumors about change with the University of Arizona and expansion of the Banner MD Anderson program, and yet each day the impact you make on everyone's lives and their cancer journey is just so impactful and so important that you continue to focus on that. I recognize that as an organization now moving from our first few years of a new startup to what's really going to require us to be successful long term of focusing on re-engineering and changing ourselves and our practice to be more efficient. I know that's going to be challenging because it's going to require even more change. And what I think that is important for us to remember is we're only a few years old, and unfortunately we're going to have to start paying back that $150 million investment in the big building that we're sitting in. So one thing that really spoke to me is about 2 weeks ago we had the annual clinical symposium where all the clinical leaders from all of Banner Health across 7 states get together, and Peter Fine in his opening presentation made a point of saying that healthcare organizations across our whole country are asking him, how can you do this? How does Banner Health handle all this change, and how are they able to position themselves to acquire an organization like the University of Arizona? And he said, you know, what's different about Banner Health from other places is that there are 3 things that we are competent in. And I thought, you know, when he said this, I thought it spoke to exactly what we're going through at the Cancer Center right now, and how can we accomplish what we're going to accomplish in expansion. 3 things: accountability, discipline, and transparency. So accountability, we are all accountable for recreating our processes and our models of care that we know today are too expensive. Oncology is the most expensive, 20% of the Medicare spend in the United States, doubling diagnosis, you know, in the next 10 years of those with cancer. We're accountable to recreate and change that to be even more efficient, to be ready for this next phase of growth. We have to be accountable to ourselves to understand that's going to be tough, that we come with positive intent, that we work through that together, and really leverage ourselves internally at the Cancer Center to be the hub and the model for all of Banner Health as we expand in the future. we're disciplined as an organization. I know we see examples of this because when Banner identifies a goal or a strategy, hold on, because they plan it and they work the plan and they make it happen, right? Even though there's challenges and obstacles, we need to do the same here at Banner MD Anderson. We need to be recognize that we're going to have to be very disciplined about, we've grown in a certain way, but we're going to have to step back, evaluate that, figure out how we can be more efficient, and continue to expand our services and support others in Banner Health. We know that we will accomplish this change because whatever is needed to be successful, we are going to make it happen because we're a disciplined organization. And then 3, transparency. Although some of our change is not popular within Banner Health or within the Cancer Center, as our division chiefs and department leaders plan together, get feedback from our team members, and make decisions on what's going to happen next in our organization, we will share that with you. We'll be honest. Some of it might not be popular, but we'll tell you what we're doing and why. And we are committed that in that transparency, we need to trust each other, and we need to have the courage it takes to try things that we are not sure might be the right decision, but we know today is no longer sustainable and we can't keep doing it. So for me, I'm thrilled I get to do that with all of you and your leaders in the departments. I'm thrilled to be part of what I am biased but believe is the highest performing oncology division and cancer center in the Valley. And I'm thrilled that we do that at a time and in a way that positions us to be the hub of all oncology care for the future in the Valley and for Banner Health. I know that all of you are committed to being disciplined about that, to be accountable to help us through that, and to be transparent when you don't agree with things that are going on so that we can partner together to make that improvement. So I look forward to our next meeting. Sorry again I can't be there today. I'm excited about joining you the next time, and I really hope that by that time I have some decisions that can share with you how we're going to grow our services further in Arizona and maybe even elsewhere in Colorado or in Banner Health. So thanks, have a great meeting, look forward to your feedback, and I'll see you next time.